Hemophilia, the royal disease. It is called the royal disease because it is a rare disease which is generally found in males. It is known as love of bleeding. It is of two types generally, A and B. Hemophilia A. It is X-linked recessive hereditary disorder that is generally caused due to factor VIII deficiency. Hemophilia B. It is also known as Christmas disease or factor IX deficiency disease. It is the second most common inherited clotting factor disease, which is after von Willebrand disease. It affects 1 in 5,000 to 10,000 live male births. There is no difference between racial groups. Hemophilia is basically of two types, internal bleeding and external bleeding, and the bleeding is directly proportional to factor VIII content in our body. So F8 concentrates are available in the market that is used to cure hemophilia A disease. There is also replacement therapy, plasma, and cryoprecipitate. But the disadvantage is that it is a viral transmission, so the large volume of this therapy is required. This is done to raise simply the F8 concentrate level in our body. Hemophilia and orthopedics. 80% of the hemorrhages, bleeding, internal or external, occur in the muscular skeleton system, while the 20% takes place in the central nervous system and other organ systems. Earlier on demand management, factor was used fourth only when the patient suffered a hemorrhage. Hemophilic arthropathy in second or third decade. Nowadays, continuous prophylaxis, which can be primary, that is started when the children begin to walk, or just after the first hemarthrosis, or it can be secondary, that is it started after several or many hemorrhages. Hemophilia A is a clotting factor A deficiency, as already told earlier. It is the most common form of the disorder, present in about 1 in 5,000 to 10,000 male births, while hemophilia B is a factor IX deficiency that occurs in around 1 in about 20,000 to 34,000 male births. There is also a rare hemophilia C disease which is caused due to factor 11 deficiency, that is also caused in males rather than females.